name is Marc Pitasi. I'm an epidemiologist at the Centers for Disease Control and Prevention. Specifically, I work in the Division of HIV/AIDS Prevention. So I work on surveillance-related projects with HIV, as well as projects with a special focus on HIV testing. I'm presenting a poster at the International AIDS Society Conference looking at facilitators of routine screening among primary care physicians. So trying to get a little bit into how we could help support primary care physicians as well as potentially other providers in their efforts to implement routine screening. To give a little bit of context, I'll just say for those who don't know, CDC has recommended routine screening since 2006, so for over a decade now. CDC has recommended routine screening for HIV in healthcare settings for adolescents and adults ages 13 to 64, as well as at least annual rescreening for persons with ongoing increased risk for HIV. But we know that that's not happening universally. We have a wealth of data at this point that all can really consistently indicate that probably less than half of the US adult population has ever been tested for HIV. So we know that there are barriers to HIV, to routine screening in healthcare settings. There's a pretty robust body of literature now that has explored and documented some of those barriers. So we conducted a survey, an online survey of primary care physicians to try to get a sense of how many primary care physicians, or PCPs as I'll call them, are practicing routine screening in alignment with the CDC recommendations from 2006, as well as to try to identify and prioritize tools and resources that might be able to help providers implement routine screening and address some of those barriers.
What do you think some of the reasons for hesitation from clinicians when it comes to HIV testing would be? Because at Contagion, our audience, we have a lot of infectious disease specialists who understand the seriousness of routine testing for HIV. So if you can give us a bit of insight on what maybe the risk factors for non-compliance with the guideline would be.
Sure. So one of the things that we found in our survey of about 1,000 PCPs across the country was a lack of awareness of the CDC recommendations. So in our sample, only about half of the respondents were actually aware of CDC's recommendation for routine screening. So I think lack of awareness is a major barrier. From the literature, there are other barriers. We know that providers are busy. There are a lot of time constraints and competing clinical priorities. So especially for providers who may practice in areas that don't have a lot of HIV, or patient populations that they just don't see a lot of HIV, they of course have to balance that with other clinical priorities that they may see a lot more frequently, like hypertension or diabetes and so on. So I think those sort of time constraints and competing priorities are a major barrier as well. There's also a lot of literature around discomfort with talking with patients about HIV, whether that could be discomfort on the provider side or discomfort on the patient side, either perceived or actual discomfort. Sometimes those conversations about sexual behavior that may be stigmatized, as well as HIV, those conversations can be difficult to have. And so providers may feel if they perceive the HIV-related risk of their patient to be low, they may not want to engage in those conversations. So those are a few of the barriers. But what we really saw in our study was a lack of awareness of the guidelines.
And are we missing a large proportion of the remaining HIV cases through non-compliance with this guideline? I'm sure it's multi-determined. Obviously, like any infectious disease response, there's going to be a lot of different factors that weigh into it. But basically, can you kind of weigh the size of the size of the issue, I suppose, in terms of missed potential to get early treatment started, things like that?
Absolutely. So there's data in the literature that demonstrates a lot of missed opportunities for testing in clinical settings, not just in general, but specifically among those who are at increased risk, whether it be men who have sex with men, whether it be persons who inject drugs or other risk groups. So those missed opportunities definitely persist. There's also evidence that around 15%, it's estimated that 15% or so of all infections in the United States are among those who don't know their status. And we know that those infections do contribute disproportionately to new transmission. So it really is important to find the needles in the haystack, especially as we embark on this new federal initiative to end the HIV epidemic in the United States. There will be a growing need to really find those patients who maybe don't disclose their risk necessarily to their provider, or maybe they have risk that they're not aware of, or they have a potential exposure to HIV that they're not even aware of that was brought to them from their partner. So it's definitely an important issue.
Do you feel that a lot of these primary care physicians really, if they heard about the problem, the response would kind of be, yeah, that seems rational, we could test? I mean, obviously you have some people who there's stigma with talking about things, but to your point about lack of awareness, is this lack of lack of concern about HIV from physicians, or is there just something not connecting?
That's a great question. I think there are a lot of factors to untangle. I think that in our study, we did see a lot of PCPs who were aware of the CDC recommendations, but still reported that they are not practicing routine screening. And there could be a variety of reasons for that. Unfortunately, our survey doesn't provide a lot of answers about why they're not conducting routine screening. Whether it's there could be institutional issues. We also saw a lot of providers who endorsed risk-based or targeted screening, so a different approach where they might prioritize screening a certain subset of their patients who they know to be or suspect to be at increased risk. So again, kind of missing the needles in the haystack that I mentioned earlier. So I think in some cases there are just practical barriers, like maybe providers want to do routine screening, but just don't have the time or the bandwidth or the resources to do so. And in other cases, there may be philosophical differences where providers maybe don't agree that routine screening is the best approach.
On top of that, would it be possible perhaps that there's an issue with general sexual wellness, the conversations around testing there, the ways that that's itself not considered routine? I mean, I think in the United States there's a culture where, for example, you go to an STD screening thing, it's thought of as a risk event based practice. Not a lot of primaries are saying, all right, it's your 6 months or your week or your yearly STD testing, even if their patients are sexually active. And so is there something here with bundling as well, the service with a kind of broader expansion of sexual health screening?
Absolutely. That's a great question. And there are efforts to sort of normalize HIV testing as a standard of care, which does involve integrating HIV testing and other HIV-related services with other STIs and other sexual health services. One interesting finding that came out of our study was actually the most frequently endorsed facilitator of routine screening by in our sample of PCPs was an integrated laboratory panel that would facilitate simultaneous testing of HIV as well as other STIs like syphilis, as well as hepatitis C. So really kind of streamlining the process of ordering those tests to make it a little bit easier for providers. So that was actually the most frequently endorsed facilitator in our sample. So I think that's a great point and an area for further inquiry.